Gabapentin recreational use. Gabapentin is a prescription medication primarily used to treat seizures and nerve pain. However, it has also been used off-label for various other conditions, including anxiety, bipolar disorder, and migraines. Gabapentin has also become popular as a recreational drug, particularly among people with a history of substance abuse. It is sometimes used to enhance the effects of other drugs or to alleviate withdrawal symptoms. However, using gabapentin for recreational purposes can be dangerous and can lead to addiction, overdose, and other adverse effects. Gabapentin has sedative effects and can cause dizziness, drowsiness, and impaired coordination, especially at high doses or when used with other drugs that depress the central nervous system. It can also cause mood changes, confusion, and memory problems. Additionally, gabapentin can be habit-forming and may lead to physical dependence, especially when used regularly or in high doses. Abruptly stopping gabapentin use can cause withdrawal symptoms, including anxiety, insomnia, and seizures. Therefore, it is essential to use gabapentin only as prescribed by a healthcare professional and to follow the recommended dosage. If you are struggling with substance abuse, seek help from a healthcare professional or addiction treatment specialist. Gabapentin is a medication that belongs to the class of drugs called anticonvulsants. It works by reducing abnormal electrical activity in the brain that causes seizures and by modulating the activity of certain neurotransmitters, including gamma-aminobutyric acid, GABA, in the brain. While gabapentin is generally safe when used as directed by a healthcare professional, it can cause some side effects, including dizziness, drowsiness, headache, and nausea. These side effects usually go away on their own or with dose adjustments. However, using gabapentin for recreational purposes can increase the risk of side effects and adverse reactions. In addition to sedative effects, it can cause impaired judgment, decreased cognitive function, and slowed reaction time, which can increase the risk of accidents, falls, and other injuries. Gabapentin can also interact with other medications, including opioids, benzodiazepines, and alcohol, which can increase the risk of respiratory depression, coma, and death. Finally, gabapentin can be addictive, especially when used in high doses or for an extended period. People who abuse gabapentin may experience withdrawal symptoms, including insomnia, nausea, anxiety, and seizures, when they stop using the drug. If you are prescribed gabapentin or considering using it for recreational purposes, it is important to discuss the risks and benefits of the drug with your healthcare provider and to follow the recommended dosage and instructions for use. Gabapentin high. While gabapentin is primarily used to treat seizures and nerve pain, some people may use it to achieve a high or to enhance the effects of other drugs, such as opioids or benzodiazepines. However, using gabapentin in this way can be dangerous and is not recommended. Gabapentin can produce a range of effects, depending on the dose, the individual's tolerance, and the way it is used. At low to moderate doses, gabapentin can produce relaxation, sedation, and a mild euphoric effect. It can also enhance the effects of other drugs, such as opioids, and can increase the risk of respiratory depression and other adverse reactions. At higher doses, gabapentin can cause more significant side effects, including dizziness, drowsiness, confusion, and impaired coordination. In some cases, it can cause a dissociative state, hallucinations, and other psychological effects. However, it is important to note that using gabapentin for recreational purposes can be dangerous and can lead to addiction, overdose, and other adverse effects. It can also worsen existing medical conditions, such as seizures or liver disease, and can interact with other medications. If you are prescribed gabapentin or considering using it recreationally, it is important to discuss the risks and benefits of the drug with your healthcare provider and to follow the recommended dosage and instructions for use. If you are struggling with substance abuse, seek help from a healthcare professional or addiction treatment specialist.